So good afternoon and welcome to today's Career Learning Link event, Sneak a Peek, Learn to Read an Ultrasound. My name's Stephanie Dunler and our moderator today will be Holly O'Brien.
Courtney,
Courtney, my bad. Courtney, you're the moderator. See, I'm telling you, we're all out in La La Land today. So this is being recorded for students in the future to watch. So please keep your videos off, students, which I know you already know how to do that. And if you have any questions during the event, just please place them in the chat box. And Holly will be monitoring the chat box and we'll get those answered. Those of you that submitted questions ahead of time, we already have those. So thank you for doing that. And your prizes will be mailed to you or given to you by your success coaches. So without any more, I'm going to turn it over to you, Courtney. Thank you.
Hi, everybody. I'm Courtney Rochette. I am the success coach for Fayette County, which I don't believe I have any students in here from Fayette County. I'm excited to learn about the ultrasound and sonography because I find them fascinating myself. But if I'm not mistaken, we have Miss Patty. I'm not even going to attempt your last name. Sorry.
That's okay, Straby.
Straby, yes. Yeah, I would not have come up with that.
That's okay.
So I'm going to turn it over to Patty, and I understand that we also have some questions that I have here. But students, if there's other questions that you come up with as we go, maybe just put them in the chat box and we can kind of address them as we go. Over to you, Patty.
Okay, sounds great. My name is Patty Straby. I am the radiology supervisor here at Gunderson Palmer Hospital and Clinics in West Union. I've been here for about 10 years and last almost year and a half as the supervisor. I personally do not do ultrasounds. Our ultrasounds here are done by Dylan, our ultrasonographer. He has been with us for a few years now. So he is also sitting next to me, but he made a PowerPoint that I believe Stephanie has, so that we will first kind of go through the PowerPoint. And like they said, if you have any questions, please just let me know, okay? We're going to kind of explain the background, the career, and kind of what ultrasound is all about. So does Stephanie have the PowerPoint? Perfect. Okay. So first we'll start what it means. If any of you guys are interested in medical term or medical field at all, it is very important to know your medical terminology. Most words can be broken down into what they mean. Ultrasonography can be broken down into ultra, which means above, sono, which means sound, and graph, which means pictures. So ultrasound uses sound waves above the human hearing range to create a picture. It also can be known as ultrasound, sonography, sonogram. One who obtains the ultrasound images is called the sonographer, ultrasonographer, or ultrasound technologist. There you go. So the technology behind it. So like I said, ultrasound uses sound waves above the human hearing range to create a picture. Sound is created by repeated changes in pressure through a medium, usually air, water, or etc., and how frequently the pressure changes corresponds to its frequency measured in hertz, or Hz, cycles per second. Higher the frequency or pitch, the higher the hertz. Humans can generally hear between 20 and 200,000 hertz. Ultrasound machines uses frequencies 150 to 750 times higher than the pitch that the young humans can hear. So it uses a much higher level. So here is a picture of the machine. The machine is on the right side. And then in the lower to that is what's called a transducer. Transducer, or probe also called, is what we use to obtain the images. So like it says in basic term, it's a computer and a transducer. The transducer acts like many tiny speakers and many tiny microphones. For a very brief period of time, the transducer sends out sound waves like a speaker and then listens for the sound waves that come back like a microphone. And this happens 1,000 to 10,000 times every second. So the computer uses the returning sound waves to put together an image that we can see. Two things that the computer considers when making the images: how much time it takes for the sound waves to come back, and how loud the sound waves come back. So like the image on the side there, the top of the image is what's near to the skin, and what is below that, I'm going to show you if I can move it. The black is the center in the anatomic fluid, and the bright white are the bones. So that is a picture of a fetus. So that right down there, the white she's pointing to is the spine of the baby. And then you can see the head up is in the front. And in the black portion right there in front of the baby is the baby surrounded by the amniotic fluid. And just in front of that is actually the placenta attached in the mother's womb. So like it says, a sound wave that comes back quickly is exposited towards the top of the image, and the sound wave that takes longer is on the lower part of the image. Like Dylan put in, imagine clapping in an empty auditorium versus in a small bathroom and listening for that echo. Which wall sounds further away, and how do you know? A sound wave that comes back loudly shows up as a brighter gray or white, whereas a sound wave that comes back quietly shows up as a darker gray. When there is no sound heard returning, it's represented as black. Oh, so that image did, okay, so this is one of the things I wanted to show. So these are two images. So by doing the entire process many times per second, we can see a real-time image. So the image on the left is a heart. The lower, so you can see the heart has 4 chambers, the 2 ventricles and 2 atriums, both right and left. At the bottom portion of that picture are the atriums. And you see those 2 kind of like, almost look like arms flapping in the picture. Those are the valves opening and closing. So when the heart contracts, the blood is from the atrium is then pushed into the ventricles, and those valves open up. To do ultrasound of the heart, it's a little bit more schooling. It is, then you are referred to as an echocardiogram, which means the ultrasound of the heart. So that we just wanted to show a quick picture of the heart there, because that is also another option. The picture on the left is not moving. That is a baby at 19 weeks. So I actually am going to try and share. Stephanie, can I go ahead and try and share my screen real quick?
Yep, I stopped sharing mine.
Okay, I just want to bring up, oops. Where did my images go? Hold on just a minute. So here is that heart again. So then here is a baby. So this is like we talked about the real live time scanning. So this portion right here is the baby's head with their spine right here. Oops, the baby kind of moved. There's the spine right there. And then you can also see the arms and the legs here. Okay, I will go ahead and stop sharing, Stephanie.
Okay, I'm bringing back the PowerPoint.
Okay. So like ultrasound, it's like the sonar similar to the echolocation seen in some animals like bats, whales, and dolphins. Sonar is used for submarines, fish finders, etc. Sonar is fundamentally similar to radar and lidar, but they are used electromagnetic waves and light respectively instead of the sound wave. So kind of on the same idea. So now, so the more technology, ultrasound offers some benefits over other modalities, including minimum adverse risks. There's no radiation compared to like X-ray or CT in our department. Real-time scanning, so we can see things as they happen. Sometimes ultrasound is used, and we kind of go into a little bit further as far as like doing biopsies, so the doctor can see exactly where their needle is going before they either pull some tissue out or before they inject anything. Ultrasound is much more affordable compared to CT or like an MRI, other modalities in radiology. However, ultrasound doesn't usually replace other modalities. It's often worked in conjunction with other modalities. And I'll kind of explain that a little bit more when we go through things. Some of the things that is used for, the most commonly known is the OB in gynecology, abdomen work. soft tissue masses, lumps anywhere on the body, vascular, cardiac, and like we said, it's not just for babies. We probably do, I would say, a little less than half of our exams are only babies. So majority, it's done multiple things. So here are some images that we shared. The first, so we'll first start with OB, early pregnancy uses. So it's to confirm the pregnancy and to confirm where the pregnancy is located, whether it's in the uterus versus ectopic. Ectopic pregnancies is when the pregnancy does not reach the uterus and is in the fallopian tube. That could be considered dangerous and unfortunately usually need to be removed. Viability, to see if the baby has a heartbeat and if it's developing. And then also when it's due, they can take measurements to give approximately when the baby is due if the mother does not know her last menstrual cycle and so on. Later in the pregnancy, roughly about 20 weeks, we check for major anatomy development. We look for any abnormalities, masses, make sure the baby is growing correctly, so determine fetus size and confirm the growth rate, measure the amount of amniotic fluid, and determine the location of the placenta and umbilical cord. 20-week ultrasound takes usually about 80 to 90 minutes. And they pretty much scan the entire baby. They look, like we said, they measure to make sure they're growing correctly, they're within the correct parameters. They check the heart. They're able to look at the fetus's heart to make sure that it's developing correctly, as well as the brain. Pretty much they scan the entire baby at that 20-week appointment. Okay, so here is some other pictures. So these are the 3D and 4D pictures. So by taking numerous images or slices, the computer can put together a 3D model to view what the baby looks like. This is probably taken a little bit later in the pregnancy. I would say probably about 30 weeks or so. And then the second one is a 4D, which are continuous 3D rendering. Due to the law of physics, they're usually only a few frames per second, resulting in choppy motion. But you can see that baby there is actually yawning or opening his mouth. So then we'll go into other exams that we do that are not OB. The first one is gynecology exams. So to look at a female's uterus, cervix, and ovaries. They're also looked at in early pregnancy ultrasounds. We're looking for any kind of abnormality area, masses, and to assess blood flow. They're also ordered on non-pregnant women for pelvic pain and other symptoms, cysts, fibroids. Here's the top picture is a normal looking uterus. And then the bottom, you can see that blackened area. That is a fibroid within the uterus. And then there's one also off to the side of there. So abdominal work is also one that we look at. It's also very common. It's look at the liver, the gallbladder, including the bile ducts, the pancreas, aorta, kidneys, and spleen. A common reason for these is to look for gallstones in the gallbladder, which can block the normal flow of bile used for digestion and causes a sharp pain, usually in the right upper quadrant of the abdomen. Other organs are examined for masses or abnormal in appearance or size. So that, like figure 1 is a normal gallbladder. It's dark. It's probably fluid fill. And then right on figure 2, there's that looks like a stone. It's sitting right there in the gallbladder, which could cause problems for the patient. The next one is an ultrasound. Next one is an ultrasound. So on the left is a normal liver. You can see the black line in there. That is the blood vessel in the liver, one of the major blood vessels. And then on the right is an abnormal area called a hemangioma, which is a benign tumor sitting in the liver there. Okay, and next we have a kidney. So on the right, there's a normal kidney. Right on top of that kidney sits the liver. And then on the right is angiomyolipoma of the kidney, which means a fatty tumor of the muscle. Hold on just a minute. Yeah. go ahead. All right, perfect. Sorry about that. All right, so then next one, we have a normal looking spleen, and then on the left is the spleen with blood on top of it. So the patient must have had some kind of trauma or something causing the kidney to bleed, or excuse me, the spleen to bleed. So it's also used for evaluating blood flow to look for blood clots. It utilizes the Doppler effect. The sound wave of a frequency is sent out and it comes back higher pitch. The object is moving towards the transducer. Conversely, if the sound comes back lower pitch, the object is moving away from the transducer. So the velocity of the object, in this case blood, can be measured by the amount of the frequency pitch changes. So this is kind of, like we said, commonly used for to rule out blood clots of the leg. So I believe he has a picture in the next one. Oh, not quite one, sorry. The machine translates this information into color, usually red and blue, to indicate the direction of the flow. And I think the next one has the clot. Yep. So this is commonly done for the venous Doppler of the leg to assess for deep vein thrombosis, or DVTs, or blood clots in the legs that stops the blood flow. So down here, you can see the red is the blood seen around the blood clot. Normally the red would occupy that entire vein. So you can see how much narrower that vein is due to that blood clot sitting there. So some career information. A typical job flow of a sonographer includes looking up for the patient history to aid in the diagnostic evaluation, of course, preparing for the exam room and patient for the exam, utilizing the equipment, its features, and scanning techniques to obtain the highest image quality possible, recognizing anatomy, abnormalities, and obtaining standard required images, as well as images detailed in them, describing sizes, appearance, hemodynamic, the blood flow, qualities, etc., in a note written for the radiologist, a radiologist who is the doctor who officially interprets the exam for the doctors, and then of course cleaning and disinfecting the room. I would say anatomy and medical terminology are the most important classes for this career, by far. They are done in dimly lit rooms. Most exams, some exams can be performed bedside, so if we have an inpatient that is not well enough to come down to our department, we can take the machine up to them upstairs. They can also be used for guided biopsies, like I said, and joint injections and paracentesis, where we're draining fluid out. The doctor is able to put the needle exactly where it needs and then take a picture with the ultrasound to make sure that he is in the correct spot. Depending on the location, some hospitals, some sonographers are required to take call and occasionally work holidays and weekends. So here's some stats for you. According to the 19 Bureau of Labor stats, annual wage for a diagnostic medical sonographer is $74,320, and that was of May of 19. Employment is projected to grow 12% from 2019 to 29. Let's see here, much faster than the average of all occupations. Employee makeup is 61% are in hospitals, 21 are physician's office, 11 in medical and diagnostic laboratories, and then 4% in outpatient care. And then qualities of good sonographer include knowledge of anatomy and physiology, strong attention to detail, thoroughness. You have to have good communications with patients, coworkers, radiologists, doctors, and of course, excellent patient care skills. So some of the education, some typically go through a 2-year ultrasound education and training. This includes an internship experience, usually on top of previous education in pertinent fields, anatomy, medical terminology, general physics, college level maths, and various humanities and general electives. Generally speaking, 4 years of education beyond high school can be expected. Associate programs exist, but an increasing number of programs earn a bachelor degree and is expected by many to eventually become the new standard. And there are programs in Iowa, or excuse me, programs in Iowa include Allen in Waterloo and the University of Iowa in Iowa City. Both are bachelor's program. Dylan here went to Waterloo, Allen and Waterloo, but I hear they're very comparable. After completion of the program, you must take at least 2 board exams to be considered credentialed by the American Registered for Diagnostic Medical Sonographers. It must be the physics exam and then one of the specialty, either abdomen, OB, breast, pediatric, or fetal echo. Other things you can do is to specialize is cardiac, vascular, and musculoskeletal, MSK. Okay, that is all we have for a slideshow. So I have some of the questions that you already gave. Should I just kind of read through them, or what are your thoughts?
Yeah, well, if you wouldn't mind just kind of touching base on those, because I was reading through them as you were going, and you kind of touched on them, but if you wouldn't mind specifically addressing each question, that'd be great.
Yep, so I'll start with the student questions. How does that sound? That sound good? Okay, so are there different types of ultrasounds? What ultrasounds can be used for besides pregnancy? And we kind of went through that, like all the different body parts. There's pretty much not a body part, I don't think. We can't look at bones. That's the only thing we really can't look at. Let's see here, like you said, about half of them are done on pregnancy. And like we talked about, the abdomen exams is probably a very large majority of our exams, as well as long as also the female. One thing that we didn't talk about is the thyroid. We can also do the thyroid of the neck to make sure that there is not a mass on that, as well as the carotid vessels in the neck to check to see if there's any stenosis or any narrowing in those blood vessels that could potentially cause a stroke or something like that. What is the best part about the job? So this is Dylan's answering these questions. The best part of the job is the satisfaction of being part of a team working towards a positive outcome for the patients. It is always good when we can help a patient figure out what's going on with them, and then work together to figure out what's going on and to get them to feeling better.
And Dylan must have had to actually go to something, correct?
Yes,
because that's how medical the world works, right? You had to, it's like I saw some conversation and I'm like, I think Dylan probably has to go do some sort of ultrasound at this point.
Yep, we can block the schedule, but then it always seems to happen that we have emergency room. That's part of this profession, especially in the medical world, not just ultrasound, but like in our department. You never know when something is going to change. You never know what kind of day you're going to have. I personally like that. I don't like routine. I like to have things change very quickly around here. But then we also have the days where there's kind of a relaxed day. So it varies from day to day for sure. Yeah. So I like I said, we like the profession. That's obviously why we got into it. So let's see, what is the worst part of the job? Dylan put down that there's limited career advancement opportunities with this field. Also, they're prone to shoulder, elbow, and wrist injuries, as the joints are important for manipulating the probe. There are exercises and everything in practices to minimize these risks, but it is always right-handed, can't really see my arm, but onto the patient. So there are sonographers that do develop shoulder problems or elbow problems. There are some things that you can do as far as advancement. Of course, with the bachelor or with ultrasound, it kind of depends. You can always go into this more supervisor role, ultrasound supervisor, also into a radiology supervisor role. So there's a little bit of advancement, but once you start getting into the more supervisor roles, then you're kind of more away from the patient care of it. So it kind of depends on where you'd like to go. So another question, how much schooling did you have to go through? It takes usually about 4 years after high school. Dylan kind of did his a roundabout way. He went to UNI for a while, and then he decided to go into ultrasound after that. What are the different organs recognizable on an ultrasound? We can see most organs, provided that they're not blocked by bone, metal, or air. So gas within the stomach can block our images. So that's why sometimes we ask that you be fasting, nothing to eat or drink. So because sometimes that gas can block from us seeing anything. Also, like for a gallbladder, we ask that you be fasting for that, because if you just ate something, then the gallbladder is contracted, it's kind of shrunk down, and we can't see it as well. So different things that we do to try and make the best images possible. Let's see here. What different careers in the medical field uses ultrasound? Is one of the ultrasound's benefit is the real-time imaging. Ultrasound is often used for guided needle injections, fluid aspirations, tissues, and it's usually the ultrasonographer operating the machine doing these procedures. I think pretty much all medical fields, all specialty areas uses ultrasound in some kind of form. It's very common for all areas to use it. And let's see here. How have ultrasounds changed over time? It's constantly improving and greatly changed since it started. Some of the early equipment was an entire room, filled an entire room, and it was quite limited what they could effectively see. The probes, or the transducers, were so heavy and sensitive to motion that they were attached by movable arms to the ceilings and walls. Now they're much easier. You can plug it into a laptop, tablets, or even smartphones, the probe. The machines that most diagnostically are, excuse me. Like the 3D and the 4D are choppy, but they're pretty good. Excuse me. Let's see here.
What have you seen as a big change? I know you're reading his answers, but what have you seen?
Just the image quality has changed so much. I've been in this field for 20 years, and image quality, I've never seen the like attached to the wall or anything like that. I've never seen that. I've just seen them. I've seen the machines get smaller over time, but just pretty much image quality, I would say.
When it went from, the typical X-ray type picture to the 3D and now the 4D where you can actually see the movement, did you need to have extra schooling on that? I mean, I'm guessing that you would, but
to go from like for ultrasound to go from like just the regular 2D to 3D and 4D, it was not really extra schooling, but they brought someone in to train as they were here. I think they were here for about a week or so, just showing them different ways to do it, different methods on how to do it. So it wasn't to go from the 2D to 3D to the 4D, there wasn't any extra like schooling. Nowadays it is taught at school during the school, but for I think Dylan, I think he learned during clinical times during the school.
Do you have any advice for students or people who are going into or thinking about going into this field? Do you have any specific advice that you would recommend as far as classes or as far as, just different things to look at?
I really, for classes, you really need to know your anatomy. Like that is the biggest class for any pretty class for radiology in general, not just ultrasound. You really need to know your anatomy, where things are, what attached to what is as far as location, what is near something else. Medical terminology is another big class. You have to, every day you see a word and you take that word and you break it down into the different meanings. Those are the two biggest class. Another thing that Dylan hasn't really touched on is the communication skills, or he did a little bit. The communication skills are also very important. You're often dealing with patients. For Dylan, it's kind of on a wide range of emotions. Usually, if they're here to see their baby, they're usually very excited, very happy. But then there's times where he sees patients and they didn't hear the heartbeat in the clinic and they're, anxious, nervous. So we see a very wide range of emotions, and just learning how to ease their mind or help them through these emotions as well. That can be, and it can also be affect, you know, us as well. It's very hard, you know, like I said, if they come over for an ultrasound and they didn't hear the heartbeat or something like that, that it's very hard to, because they're all obviously going to be very upset. So communication is a big thing, talking to them through the exam, telling them what they're going to be doing and stuff like that.
We had a student that has a question as far as the gel that is used. Why is the gel necessary?
It helps, it's probably more of a question for Dylan, but it helps the sound waves to go through effectively and for us to hear it better. It's kind of like a, I don't even know how to describe it. It just helps to hear to hear better, to hear the sound waves come back better.
Like a magnifier for those?
Yeah.
Is that the word?
Yeah, that's probably a good word for it. All right, any other questions? There's one more on this list. I don't know if you want me to take that one. Recommendations for programs in Iowa. Like I said, Dylan went to Allen, but both Allen and the University of Iowa have similar programs. We don't know too much outside of Iowa's schools. Like I'm sure there's some in Wisconsin. Mayo Clinic, I thought at one time had an ultrasound program, but I'm not quite sure. Like we're just not as familiar with those schools. But either one, University and Allen are, I think, both excellent schools. And I think another thing too is like another common question is you do not need to be an X-ray tech to be an ultrasound tech, or vice versa. So just think that.
So they're two different things.
Correct. Mm-hmm. But like in radiology, like if you want to be an CT tech, then you need to be an X-ray tech first. So, but where ultrasound, you can be ultrasound and just ultrasound.
Okay, that makes sense.
So, any other questions?
If we went back to one of the baby ultrasounds quick, could you tell us what a few of the numbers mean?
Oh, sure.
Let me go back.
I'll try. Dylan probably would be the better one to ask, but. So are you looking at? Do you want to look at the baby picture?
Yep, let's look at the baby. Okay. Sorry, I was muted. Like any of these numbers here. I know it's not blown up on your screen, students, but I think you're all pretty much close enough where you can see, like, what do any of these numbers mean?
I unfortunately don't think I can answer it completely. I know that FR is and 31 hertz is the amount of the frequency that is going in. The C62 is what type of probe that they are using, but I don't know what the 55% is, or the P-low or the H-gen is.
So some of those might just be more like the machine specific, not Correct. Technically for the baby.
Correct. Yep. It's all what the machine is doing on its own. Where it says profile, that is something that the ultrasound technologist would have put in. Just labeling all the pictures, so when a doctor takes a look at it, they can see everything, like, so look for the profile picture and that kind of thing. Like I said, when they do an ultrasound at 20 weeks, they look at almost the entire body of the fetus to make sure everything is growing correctly. So then that's where they label that kind of stuff. But all those numbers, that's all machine, and I'm sorry, I don't know for sure what they all mean.
No, that's okay, but they're more, like I said, the machine specifics and not like baby specific.
Yeah, that stuff is usually, I don't want to say, it's usually not controlled by the technologist. They can adjust depending if they need to see something a little bit brighter, a little bit darker, but for the most part, it's all kind of done by the machine.
Do we have another question in the chat? is the baby ultrasound how you tell the sex of the fetus?
Yes. Yep. That's again usually done at the 20 weeks. Sometimes it can be seen earlier, kind of depends, but yes, that is what is also looked at the 20-week appointment.
Can you share the secret on how that's done?
It's just pretty much looking for just scan down towards the pelvis region, and if you see a penis or if you don't, kind of a thing.
My sister told me that for a female, when she was having kids, she always looked for a hamburger bun. So I just think that's really funny that she says if you see like a hamburger bun, you know it's probably a female. And so I think that's kind of a funny tidbit.
Yep, that's usually what they look for.
That's funny. That is. Now, have you ever, not you, but have you ever, can people get that wrong sometimes?
Yes.
I mean,
yes.
Right? That does happen.
Well, I've always heard of it always happening. I don't know for sure if Dylan has ever gotten anything wrong before, but it can happen. There's always, what can also happen is so the umbilical cord is also around there. If that's some close down there, it may look like something, it can vary from, but yes, it can happen. I don't know if Dylan has never said he's gotten it wrong before, but
we won't throw Dylan under the bus today. No.
How about with the advancement in technology? Is it uncommon if they're expecting one child and then all of a sudden it's two because maybe it was hiding behind one, or is that pretty easy to notice nowadays?
It's pretty easy to notice nowadays. I know Dylan has found several set of twins, but it's pretty common to find it right away. So.
When people find out that they're having twins, is it more excitement or more, oh my God?
I think it's a lot of shock and initial shock and then excitement, but I think it's a lot of shock at first. So.
Any of your students on?
Twins,
are you a twin? Sorry. I was just asking if any of the students on, if they happen to be a twin.
Yeah, usually they can tell right away if there's more than one there.
I'm a twin, but it was back in the day before the whole sonogram thing. So it took a while for my mom to figure it out.
Yeah. That's nowadays.
How did she figure it out? Did she know, Courtney?
She knew.
Oh, she's
like, there's movement over here and there's movement over here. And she's only 4 months along. She's like, no baby's that big.
Mm-hmm. Human intuition goes a long way in that.
Yep. Oh, we did have a twin. Elizabeth is a twin.
Did your mom know Elizabeth? If she was having twins? No, it's one of these pauses. We have to wait for the chat. Yep, she did know.
Yeah.
Very
Nowadays,
fun.
It's pretty common.
Well, does any of the students have any other questions? We'll give it just a moment for the chat box, but what awesome information. I mean, run through like a quick everything. Ooh, have you guys ever found a cryptic pregnancy late in term?
Ooh.
No, not cryptic.
Ectopic?
Ectopic. May it know? Do you see the chat?
Yeah, I do. I'm not sure what they mean by cryptic, or was it ectopic?
I would think it's topic is what I don't know that, but.
There you go. Yep.
Ectopic.
Ectopic. Usually not late in the term. Usually it will cause problems before it gets to, I would say past 15 weeks. By 15 weeks, we would know.
And what exactly is that? Can you tell those of us that don't know?
So an ectopic pregnancy is after the egg is fertilized, it moves down into the fallopian tubes, into the uterus. An ectopic pregnancy is a pregnancy that is usually found in the fallopian tube. It never makes it to the uterus. What can happen then is if it starts growing in the fallopian tubes, it can expand and then even cause that tube to rupture and cause bleeding and stuff like that. Unfortunately, ectopic pregnancies do not survive. It's usually need to have it surgically removed. And usually sometimes what happens, they need to also remove the fallopian tube as well, sometimes the ovary. But it would be in early pregnancies. Like I said, I think I would say even maybe past 12 weeks. I've never seen a ectopic pregnancy past 12 weeks. It's more like 6 to 8 weeks or something like that when it starts growing. So no, not late in term. But good question, very good question.
I found it really interesting of how many different occupations there are. You know, you hear ultrasound and you immediately, or at least my brain immediately goes baby. And you don't think about the fact that, you know, thyroid, liver, spleen, like there's so many different ways that different uses for it.
Yep, ultrasound is a very commonly used in radiology department. I see the question, what kind of abnormalities can you see in an ultrasound? Besides OB, so for OBs, they're looking, like I said, at that 20-week appointment, they're looking at the heart to make sure that the heart is formed correctly, to make sure it has 2 atriums and 2 ventricles. We then look at the baby's brain to make sure the brain is developing correctly. Also looking at the legs, they measure both legs, both arms to make sure that they're equal and both growing the same. Also, they take a look at like even the facial structure. They look at the nasal bone. Some things then give clue. They also look at the hands to make sure the hands are not webbed, and make sure the fingers and the hand are also developing correctly to make sure that there's no chromosome abnormalities or anything like that. Outside of OB, abdomen is, like I said, very common. We're looking at gallstones. To look for gallstones, ultrasound is the best modality to look at it. It's not as seen as well in CT. Vessels, the DVTs, is also much more preferred to view in ultrasound, to rule out in ultrasound. So that's looking at the veins in the legs, the veins in the neck. The carotid ultrasound is also very common to see if the patient is at risk for a stroke, to see if their blood vessels, if there's any clots or if it's narrowed. The aorta in the abdomen is also looked at just to make sure they don't have an aneurysm. Kidneys, to look to make sure that they don't have any kidney masses. Again, thyroid, look to see if there's any masses. So pretty much like anything except for bone we can look at pretty much with an ultrasound. And like Dylan said, like sometimes we use what we see on ultrasound, how it looks in ultrasound, and then compare what it looks like in a CT to see how they match, to see if they're either benign or if they're a cancerous tumor. So we all kind of work together. Any other questions?
I don't see any. Well, thank you. Students that are on, thank you. I will be sending an evaluation for the event and the link to the recording within the next few days. So just give me a few moments to download the recording, and I'll make sure to download and give you that recording too, okay? Because I mean, that'll be fun, and you and Dylan can watch it and share it with your department as well.
Okay.
But what great information, and we thank you guys for your time. And yes, please tell Dylan, sorry he had to go and we didn't get to talk to him, but we understand.
Yep. Yes. Yeah. If anyone has any questions, please reach out to me.
So do you mind if I share your email address with these students that attended today in case
nope,
they do?
that is okay. I think if you want to do like a job shadow, I think that is also an option as well. So just let me know if you want to stop by the department for a while.
Perfect. Well, thank you so much, and everyone have a great day.
All right. Thank you.